Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well,
Okay,
good morning.
we're on. Good morning. It's not raining today so far.
Well,
you got
it's
some rain this
spotty.
morning?
No, I didn't. When you look out west, it looked really, really cloudy. But thank God right here, I'm sure I don't have my phone. I left my phone
You must
in
feel
my
naked.
apartment.
You must feel naked.
No, I can see Wendy sending me the sunrise, and I'm going to miss it for a while.
I have my phone. If you need to do something, go use your phone.
Yeah.
But Dr. Mencia is here, of course, looking as gorgeous as ever, and he has big news for us.
Yes, Anita, let me tell you. This week, this past Wednesday, I went to the Boynton office. We were doing a patient under anesthesia, and I wanted to be there for the patient to make sure there was not only the anesthesiologist and the specialist that was doing a few extractions and implant on a 94-year-old lady. And I said, I want to be there, for this lady, just to make sure that I check her before, during, and after the procedure. So I did go there we managed to put her under sedation. We did all the dental procedure. Everything went fine. But I told the office, since I'm going to be there and I cannot be there doing nothing, like you guys were saying on the previous half hour, give me some patients. If they want to see me, somebody want to see me, I'm going to be there. Let the patients know. So a lot of the patients came in, and people that listen to us on the show, they went there and they went to see me, and they were so happy, and all the dentists were so happy. Oh, we're so happy that you're here, because they listen to us, the dentists. They listen to the show. And they say, you should come at least once a month. But I saw so much positive vibe and so much good feeling that I say, listen, if I can make at least half a day a week, I'm going to do it.
Yay! So I've always felt this because when I do go to Boynton, I love the office. It's gorgeous. It's beautiful. It's in the right location. But Dr. Mencia is not there, and I always, yes, Dr. Rosemary Mencia is there, but not Dr. Andy, and that's a wonderful thing to do.
So I will try to probably a Tuesday afternoon. So for the people that live in the West Palm Beach area and they want to come to AGI, and they want to see me, I probably will be there. Dr. Ecker, I think he's there on Thursday, and Cindy, the nurse practitioner, is there all the days of the week. So probably a Tuesday afternoon, because I know a lot of the patients, they want enough time to get ready and wake up and have. If you come for the first time to see me, it's better to come on an empty stomach in case I need any blood tests or anything like that. We can get that done. And one of the patients that came to see me, he needed some blood work. And another patient that listened to us for the past 4 or 5 years, he said, I listen to you every Saturday. And he was so happy. He said, you don't have to tell me anything about you. I know everything about you. Let me tell you about my medical problems. I thought that was so funny. I said, okay, great.
Now he wants to come on the radio show, right?
Yes. But he was so happy to say, oh, you have a podiatry. I need my nail clipping, please. So I said, okay, we'll set you up with everything. So it was fun. It was, I enjoyed it. It was busy. And, I love to help something lift off the ground. So I think
just got an idea.
Mm-hmm.
Maybe we need an audience here in the studio. Maybe some people
we have to
who
do
are
a
very
TV.
special.
We have to do that TV.
No, we could do the radio for the moment. What you could do is you find some patients who really like the radio show.
Right.
Invite them and they can come for a little bit. They would love that.
I think we need a bigger room. We have so many patients that would love to be here and to talk. And
we'll squeeze them in here.
We're squeezing them in here. We put half of them there with Richard in the control.
Yeah, right.
In the control panel, like the Muppet Show.
Yeah.
Richard goes, there goes my job.
Yeah, there goes his. No, but I think it's true that people, first of all, you're a celebrity. So, because you're on the radio, but you're also a very, very fine doctor. So, when they do see you and they really like you, your patients just really love you. I see that. They might just like to come to see what happens here, or maybe someone special. Just, I don't mean all of them. You can, from time to time, you decide if you want to invite them, they could come for a little bit to watch how it goes. It's not a bad thing.
Oh, sure.
Maybe someone who really listened to you well, and they've gotten well because of it. Someone very special
yes,
that way.
Yeah. That would be nice.
That's something good to do, right?
As like one of my patients say, he loved the show because he says it's not an infomercial. It's very educational. You're always educating. So, and he say I tune in every Saturday because I just love the show. And even when you guys give your phone number and the website and everything, it just, sometimes you guys even forget to do that. So it's so beautiful that, it shows how much you guys care about, educating more than anything else. And that's what it's all about.
I learned so much from you. Are you kidding? I've learned so much from you,
Anita,
Dr. Mencia, for so many years. Yeah, well, you're very smart, but you're very caring. Thinking about what the people said last time on the last segment, you probably see people who are not working and people who really have nothing in life to look forward to. And as a physician who really talks to people, because that's what you do, I mean, you don't just start pushing pills. You want to know all about them.
No, it's the biopsychosocial aspect of anything.
And so you could probably see someone who all of a sudden now gets a job, or something happens in their life and it changes their health. It's
so funny. One patient that the dentist were talking to the patient, and the dentist said, I want to do a study for sleep apnea to the patient. And the wife say, well, I don't know, because just the memory is so bad and I don't know if we can do it. So the dentist go and say, why don't you go and see the geriatrician? Why don't you just go in and have the geriatrician talk to you and see you? And I say, the wife say, okay, we have a primary. We go to, the guy is a veteran. So he goes to the VA and get his medication from the VA. And get the medication from the VA. And they say, okay, we're going to go ahead and see the geriatrician, but I don't know about the sleep apnea. Now, they didn't tell me that the patient really came in to get an evaluation for sleep apnea. They didn't say that to me. So I'm taking the history on this guy, and when somebody come and tell me that you have Alzheimer, of course, I want to be respectful to the patient, but I have to talk to the caregiver. Because if you have Alzheimer's, your information is going to be off. But this guy was giving such a great history. I said, what are you talking about Alzheimer's here? This guy's history is so good. This Alzheimer's doesn't make sense. So I said, had they checked his thyroid? They said, oh, yeah, he's on thyroid medication. Okay, that's a good one. How about the vitamin level? We need to check vitamin level. We're going to do that today. But he didn't fast. That's why we say, if you're going to come and see me at the Boynton office, come on an empty stomach. But for the vitamin B12, folic acid, vitamin D, all the vitamin that I do, you don't have to be fasting. So I said, let me check the vitamin level. So I'm talking, and I see the next side was kind of big, and the guy's a little bit big. And I say, have you ever done a sleep apnea study? And the wife say, why? The dentist told you? I say, what dentist? We got referred here from your dental department. They say to come and see you. I said, well, why do you go to the dentist? To do a sleep apnea evaluation.
This is...
So I said, but you don't see the connection between sleep apnea and forced Alzheimer's disease? And she said, oh, there is a connection. I said, yeah. If you have sleep apnea, you can have a heart attack. You're going to be tired. You're going to have lost sex desire and libido. You're going to have depression, but it's a pseudo-depression. It's a forced depression. And you're going to have what we call pseudo-dementia. It's not a true dementia. So I started explaining to the wife now, because I say, I think the patient is the wife, to tell the wife, you got to get motivated to get this guy to do the test. So I started explaining to the wife, and I say, if we do the study, there is now a device that the dentist will make for you, that you don't have to wear that mask. And that was her fear. She did not want to see the husband wear the mask.
Interesting.
She said, I have a friend that have the mask, and it's like out of space with this huge machine. I can sleep. So she was thinking, I said, we don't have to do that. Nowadays, we have a device, and we just put the device in his mouth, they bring the jaw forward, end of study. You are done.
Fantastic.
And your husband's memory is going to get better. And the VA put him on one medication for Alzheimer's disease that has a lot of bad side effects. And I think, going through the list, he was getting them on. And I said to the wife, tell the VA Dr. Mencia is your new doctor. They all know me at the VA. And the moment they hear they say geriatrician, they don't have a lot of geriatrician at the VA, very few geriatrician. The moment they say, oh, you have a geriatrician on the case, they back off. Whatever he's doing, just tell us, we write the prescription, and you get your medication.
Fantastic.
And then they'll put you just with a nurse practitioner to get your routine medications. And I said, we have to get him off the medication. Oh, she went crazy. Oh, no, his memory. I said, that memory is going to get better. I am telling you. You want to spend some of the insurance money? We can go ahead and do an MRI of the brain, a CAT scan of the brain. I can do an electroencephalogram of the brain. I can bombard that brain with $3 million. But I am telling you, it's a simple solution. If we see that he has a memory problem or mild depression, we can come back and treat that. But let's go to the root of the problem of your husband.
I am so thrilled to hear this story.
So when I got to see that one patient, every patient was interesting. It was one of my patients that also listened to us, that she has breast cancer. It's called ductal cell carcinoma. It was slightly invasive. And they wanted to do all this kind of chemotherapy, radiation, and then after all of that, then we're going to do the mastectomy.
Oh, my
And she came to me and I said, well, look, been through that with other patients. I disagree with the approach. If we need to send you to New York, if I need to send you to Miami, if I need to send you to somebody good. So I explained to her what is ductal cell carcinoma. And let's explain to the audience. The breast, when you look at a woman or a man's breast, when the woman is pregnant, the portion of the breast that produces milk are called the ducts. And sometimes inside the ducts, because those cells replicate, they divide all the time. One of them can go crazy and produce a cancer. But it's not a cancer like the supporting tissue of the breast. Those ones tend to fly to the lymph node. The one in the duct, they don't fly all over. They are contained because, imagine you have this thing that produces milk. You cannot have milk coming on the side of the breast. It just comes through the nipple. So I told her, I make my drawing. I always make a drawing for my patient. Make my drawing of a duct, of what a breast look like, what a duct look like. And I say, your cancer is right there. All we have to do is go in there, go around your nipple, get that duct out, take it out, and she's past 65. She's not going to have more babies. Take that duct out, take that out, look at the tissue, look at the surrounding. If everything is localized in there, we are done. If you want to do chemotherapy or radiation, then you can decide that later. And she's scheduled for this Monday to undergo the surgery. So I say, get the surgery done. No biopsy, nothing else, just get the duct out. Don't let a needle, because once you put a needle, if you imagine the tissue like in 3 dimensions, if you're going to get to the core of an apple, and the core of the apple has a bacteria, when you pull out the needle, you're going to bring the bacteria out toward the rest of the apple. I say, when they go in there, just let them go there, put the whole duct out, and take it one step at a time. Because, oh, no, they told me I have to see the the oncologist and the chemo specialist and the radiation specialist. I say, go and see everybody. You don't have to do anything. You can take it because they think, a lot of patients think, especially when they talk about cancer, that, it is a package deal. I have to take the whole package or they won't even look at me. Not true. You are a human being with the right to choose. There are patients with breast cancer that choose to do nothing. And I don't turn my back on them. They are human beings. It's a person's right to choose what they want with their life. I had a patient that has a breast cancer basically right on the surface on the skin. And they wanted to rush her and do surgery. But the daughter was getting married. Her only daughter was getting married in LA. So she said, I don't know what to do. They forcing me and I feel so guilty because I said, you know what you do? You take a little towel, put it on your breast, go and get yourself a night dress, get your hair done, go to the wedding. When you come back, we do what we have to do. And she said, that's what I wanted to hear.
Dr. Mencia,
a weekend is not going to make such a big difference. And the wedding was like within that week. I said, just put something, So I gave her some non-adhesive gauzes. So not the one that stick to the skin, the one that you just put over the skin. We did that. She went in. She went to the wedding, got beautiful pictures with her two breasts and everything. Came back. When she came back, we had to do a radical mastectomy. But it was going to be done anyway. But at least she got to the wedding the way she brought up her, her daughter in life.
This is why you are such a,
and
good
that's
teacher.
That's what medicine is all about. It's called biopsychosocial. There's a social component. There's a biological component. And there is a psychological component to everything, we suffer in life. Even a simple headache have those three components. If we keep those three in mind, we're going to be human doctors.
Oh, this is why you're my most special physician. And I want to now give the phone number.
Okay.
We don't give them often enough because we get involved in this, but let me do this. So in Fort Lauderdale on Commercial Boulevard, the number's 954-489-1345. And I'll repeat that.
And the Boynton office is open today. It's open today. It's open.
And it is open today.
Yes, they're going to be seeing patients there.
Office. Okay,
Saturday.
We give the address
it's going to be their
everything.
first Saturday.
But is it Saturday open in Fort Lauderdale?
Fort Lauderdale Saturday.
Oh, this is getting
medical,
big time.
Medical and dental, we are open in Fort Lauderdale.
Okay, so it's 954-489-1345. Now, if you want to go to Boynton Beach and see their gorgeous office up there, it's just on Hagen Ranch Road. It's just between Boynton Beach Boulevard and it's getting closer to Woolbright. You can get there if you take, if you're coming from the south, you can get off at Atlantic and go up to Hagen Ranch Road and you'll find it. If you're coming from the north, go to Boynton Beach and then go on Hagen Ranch Road and head south. Phone number, 561-270-6494. 561-270-6494. And then one thing that's really important, and we want to talk about this again, if you are at home and you just can't get out to see a doctor, there are very few doctors who will come to see you at your home. I will tell you, oh yes, you might get, some people who are technicians, but if you want the real thing, call the AGI Medical and Dental Centers and tell them if you have dental problems, they'll come and help you at home. It's a rare institute that we talk about.
I witnessed. It was so wonderful going to AGI in Boynton Beach. I witnessed a patient that came in, and the patient said, she came from downtown West Palm Beach to the Boynton office. And I said, well, you have a dentist there in downtown West Palm Beach? He said, we have a dentist. We called the office. They say they're going to call us back. They never call us back. Then we call again, and the person is having, a bad infection. They say, the heck with this. So they started calling around downtown West Palm Beach. And somehow in the computer, I guess, AGI Dental Medical popped up. And so they called the office. They got answered immediately. They say, what's going on? I said, just come right in. We'll see you. And the patient dropped all the way down to be seen because they say, the phone was being answered, and you guys deliver. Especially when you have an emergency, where you're going to go with a dental emergency. You don't want to go to an emergency room. They don't have dentists. You don't want to go to a walk-in clinic. They don't have dentists.
Well, you're right. You're right. It is interesting because it's the one area of when you're suffering with something dental, they say wait for Monday for the dentist, right?
And I have one of my dentists. He's Jewish, so in the Jewish religion, Sunday is the first day of work. So on Sunday, me and him, we take dental emergency. So when we got, sometime on Sunday, we get patients that call and they have a dental emergency. We have a guy that was going on a cruise and had a dental emergency. We brought them right in. We took care of the guys and back on, made it to the cruise, and we did great. So,
no, yeah, and please,
we are there for the community.
You bring a good point. Don't go on a cruise if you don't feel well. You got to be careful.
Absolutely,
remember?
You're right. Once you are there in, deep sea.
Oh yeah, no, it's
say,
dangerous. So who's going to help you?
The closest clinic is in island, blah blah blah. So
be very careful.
And the doctor is in the hammock having his margarita. Check the vital sign, please. Call me in 2 days.
No, it's true. And the other thing that I think is very important. We're having a lot of rainy weather. And I think that people have to be very careful. If you're an elder person, you have to be very careful about getting wet, going into the air conditioning after you get wet. It's not a very good thing. Carry your umbrella with you everywhere you go. Carry a little rain hat, because people don't realize that can really start to cause problems.
Well, another thing with the rain is that people have to be careful, especially if they use a walker or a cane. Because a lot of people with devices tend to fall more than people without devices. Because if you have a cane when it's dry and sunny, you just put your cane and you get around like nothing. But when it's wet, that cane will slip forward and there you go.
You're right.
And a lot of times they hit face first.
Yeah, and driving in the rain, and also sometimes because we've had really bad storms around here. So it's better not even to go out if it's really storming up.
Except if you're going to AGI.
Oh, yeah, I was just going to say, I knew you were going to say that.
And if you cannot make it to AGI, we'll do the home visit for you.
No, I know. Well, with the home visit. But, that really is true. There are people who really need you, Dr. Mencia, at home. They can't get out. And I've always felt that so inhumane that you expect someone, bundle them up, take them to the doctor, and they can hardly get out of bed. It's not fair. So I'm really glad. Well, I guess all good things have to come to an end. So right now we know that the Boynton office is open, and the phone number there is 561-270-6494. And the Fort Lauderdale office, of course, is open, and it's 954-489-1345. It's Saturday, and they are open to help you.
Both offices are open today.
Yes.
So.
And you have so many people. The thing that you're going to find when you go there, and I personally have to tell you, because I go there for my health and my husband's health, is everyone is so open and willing and happy and friendly, and you have a concierge in the front. It is not, you don't go in. I love that concierge, and we run out of time.
One of the patients, he was talking about the constipation. I said, don't you hear Anita and me talking about Bill and the prunes?
Prunes, he's a constipation. Get the prunes, right?
Thank you, Anita.
Prunes. Thank you, Dr. Mencia, and have fun today.
All right.
Bye.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.